हाँ, अंदर की तरफ खींचिए, मुट्ठी खींचिए, नीचे की तरफ खींचिए। अभी दर्द हो रहा है, हो रहा है। अभी कहाँ पे दर्द हो रहा है?
यहाँ पे हो रहा है।
इधर पे,
उसमें नहीं सर, ये हड्डी जो है ना। हाँ
इधर।
हाँ।
फिर से खोलिए, पूरा हाथ खोल दीजिए, फिर से कीजिए। अभी चालू हुआ, अभी चालू हुआ। ठीक है, अभी इसमें नहीं हो रहा है
नहीं नहीं।
तो चलो ठीक, तरफ कीजिए। अभी इसको मुट्ठी कीजिए। अभी क्या दिक्कत हो रहा है
एक कलाई में लग रहा है सर।
इसमें? बहुत ज़्यादा या थोड़ा
मतलब
बहुत?
थोड़ा लग रहा है, जो
थोड़ा
पहले से कम है, लेकिन ये जो
इसमें
पूरा है ना,
पूरा जॉइंट में लग रहा है।
है।
फिर से इस मुट्ठी को अंदर की तरफ कीजिए, ऐसा मुट्ठी कीजिए। अब नीचे की तरफ कीजिए। अभी लग रहा है, ठीक है, इस पोजीशन पे। अभी इसमें दर्द हो रहा है, ठीक है। Did you show what exactly we was trying to see from that hand? That is the condition where the two tendons of the wrist and the thumbs is to be involved, and that's the painful condition what's called as a Quervains Tenosynovitis. This condition is more common among the people those who used to do these movements, rotational activities. Again, this condition is quite common among the housewives, those who used to do lot of works using their hands. And the two tendon, mainly abductor pollicis longus and the extensor pollicis brevis, which makes the anatomical snap box, used to be involved, and that's the main two tendon of this D. Quervains Tenosynovitis. I show you the patient where she was trying to move the hand like this, and it was quite painful. Most of the patients, they cannot make the thumb inside, and that is what is this condition is. What exactly used to happen in this condition? There is a micro tear, there is a micro tear of these two tendon, and that result in tremendous pain. Exactly to say, there is no such x-ray which can prove this condition, because it's not the pathology of a bone, it's the pathology of the muscle. That's why MRI is the last line of investigation which can diagnose this condition. But we physios, we used to do a special test. By that we can understand, yes, this is the condition. That's, it's called as a Finkelsteins test. What is exactly this test? You saw, we make the patient to make the thumb inside, we make the patient to make a fist, and we are trying to do the ulnar deviation like this, and it was quite painful. This what it's called as a Finkelsteins test. And by this test only we used to understand what exactly the condition is, and by this Finkelsteins test we can diagnose the condition D. Quervains Tenosynovitis. Yes, physiotherapy is one of the treatment, one of the important treatment which can treat this particular condition, and which can again decrease the further tear of this tendon. And at the same time, patients were advised to use a thumb spiker splint, which will protect the tendon from the further injury. And at the same time, they are supposed to use the ice compression at home. We used to use different modalities to treat this particular condition, and one of the best modality to treat this is the laser. So that's how physiotherapy works to treat this D. Quervains Tenosynovitis. Yes, it's the most common condition among housewives, among bikers, and again this is one more most common condition among the young generation, those who used to use the social media for a long time, and that is just because of the scrolling of the Facebook and the WhatsApp, and that resulted they used to have a tremendous pain on this region, and that's what is called as a smartphone thumb syndrome. So this is what is the D. Quervains Tenosynovitis. Thank you. It's Dr. Tapos again, and those who are watching this video, don't forget to subscribe and like the channel, because we will be sharing lot of medical information with you people. Thanks one again.